In the ever-evolving landscape of healthcare, a paradigm shift is underway, one that places the patient at the very center of the diagnostic and treatment process. This revolution, known as patient-centered diagnostic labeling, represents a fundamental change in how we approach medical care. It is a move away from the traditional disease-centric model towards a more holistic, patient-centered approach. This approach emphasizes not just the biological aspects of a patient's condition, but also their individual experiences, values, and preferences. Patient-centered diagnostic labeling recognizes that each patient is unique, with their own set of symptoms, circumstances, beliefs, and desires. It acknowledges that effective healthcare requires more than simply identifying and treating a disease. It demands understanding the person behind the illness and tailoring care to meet their specific needs and goals. This approach fosters a stronger patient-physician partnership, promoting shared decision-making and ultimately leading to improved health outcomes. At the heart of patient-centered diagnostic labeling lies the integration of three key elements: competency-based medical decision-making, compassionomics, and patient and family-centered care. These elements, when combined, create a powerful synergy that transforms the healthcare experience. Competency-based medical decision-making ensures that all clinical decisions are grounded in the latest scientific evidence and best practices. This means clinicians are constantly updating their knowledge and skills to provide the most accurate diagnoses and effective treatment plans. Compassionomics, as the name suggests, emphasizes the importance of compassion in healthcare. It recognizes that patients are not simply cases to be solved, but individuals experiencing fear, uncertainty, and vulnerability. Finally, patient and family-centered care recognizes the crucial role that patients and their families play in the healthcare process. It empowers them to actively participate in decision-making, respecting their values, preferences, and cultural beliefs. This approach fosters open communication, builds trust, and ensures that care is truly patient-centered. The cornerstone of patient-centered diagnostic labeling is the tri-label diagnosis framework. This innovative approach encourages clinicians to look beyond the traditional disease label and consider two additional dimensions: the patient's experience of illness and their individual preferences. The tri-label diagnosis comprises three components: disease, illness, and patient preferences. The disease component refers to the biological and pathological processes underlying the patient's condition. This is the traditional medical diagnosis, often based on objective findings like symptoms, physical examinations, laboratory tests, and imaging studies. Collectively, these assist the clinician in articulating a comprehensive phenotype and endotype for his or her patient that are indispensable for a precision medicine approach. The illness component, however, delves into the patient's subjective experience of their condition. It explores how the disease affects their physical, emotional, and social well-being. This includes understanding their fears and concerns and how the illness impacts their daily life. Finally, patient preferences recognizes that patients are not passive recipients of care, but active participants in their health journey. This component considers their values, beliefs, priorities, and goals for treatment. It acknowledges that there is no one-size-fits-all approach to healthcare, and that the best treatment plan is one that aligns with the patient's individual needs and preferences. To illustrate the power of the tri-label diagnosis, let's consider the example of sepsis. Sepsis is a life-threatening condition that arises when the body's response to infection injures its own tissues and organs. In a traditional medical setting, a patient might be diagnosed with sepsis based on clinical parameters like fever, elevated heart rate, and laboratory findings. However, this label alone fails to capture the full picture of the patient's disease diagnosis and experience. Using the tri-label diagnosis, clinicians would delve deeper. They would explore the disease phenotype and endotype, as well as the illness component by asking the patient how they are feeling and how the disease impacted their daily life. They might discover the patient is experiencing anxiety about their prognosis. Understanding these aspects allows for more tailored interventions, such as effective and specific interventions addressing particular phenotypes and endotypes of sepsis and providing counseling or medication for anxiety, as well as involving social workers for additional support. Furthermore, considering patient preferences in diagnostic workup and treatment is crucial. Some patients might prioritize aggressive treatment options, even if they come with significant side effects. Others might prefer a more conservative approach, focusing on comfort and quality of life. By understanding these preferences, clinicians can develop a treatment plan that aligns with the patient's values and goals, ultimately leading to greater patient satisfaction and improved outcomes. In conclusion, patient-centered diagnostic labeling represents a paradigm shift in healthcare, placing the patient at the heart of the diagnostic and treatment process. By embracing the tri-label diagnosis and integrating competency-based medical decision-making, compassionomics, and patient and family-centered care, we can deliver truly holistic and personalized care. This approach not only improves diagnostic precision and therapeutic efficacy, but also enhances the patient experience, fosters trust, and ultimately leads to better health outcomes.